Again, my name is Susan Harrison. I am the field representative for provider type 93, the substance use treatment providers. And with me today, I have Alyssa Drucker, who is also a field representative, my wonderful backup, and also we both work for Gainwell Technologies, which is the fiscal agent for Nevada Medicaid, or the DHCFP. And from that division, I have Beth Scott joining us as well. She is representing the policy side with DHCFP. So thank you, Beth, for joining us. And with that being said, I'm going to go ahead and get started with our presentation today. So I just want to kind of go through a high-level overview of the order of enrollment for PT93s. If you're struggling with that and not sure which enrollment to submit first, how that's supposed to look and work, and then some of the updates that have happened since the last workshop that we did. We've had quite a few web announcements go out, so we'll kind of cover those as well, so you'll have those for resources to refer to back in the future as well. So having said all of that, I'm going to go ahead and we're going to get started. The first thing I'm going to have you look at is our slide deck, and we're going to cover some of the highlights there. So I'm going to share my screen. Thank you very much for letting me know. All right, so it looks like there's a little bit of latency, so we'll just have to be patient as we go through the slides and the training. We already went through here's where your reaction and chat and mute and that kind of thing are showing on your WebEx window, in case you need to see that as a reference. So some of the objectives that we're going to be covering today is understanding how to enroll as a PT93, determining the order of enrollment based on your group's specific situation. We are not going to cover the next few bullets because this is a separate training, as I indicated. And then we'll figure out how to locate contact information and resources as during the enrollment process, and then moving forward for claims, prior authorizations, payments, etc. So as you probably are all aware, I think you're all in the enrollment process stages. Your current provider type is either a 17215 or a 17171. Those two provider types are no longer eligible for enrollment as in the Nevada Medicaid program. They became the 93. These two contracts will terminate and go away altogether at the end of March of 2025. So effective 4/1, if you continue to do substance use treatment services, you are going to need to be enrolled as a provider type 93. So that's kind of your drop dead date, is that 3/31. The new individual and group specialties that were created are listed here on this slide. On the left-hand side, you see your individuals, and on the right-hand side, you see your group. So the 704 group, or specialty 704, that is for your residential services, residential treatment level 3. 707 for substance use treatment is the replacement for the 17215. And then the 708 the opioid treatment program is the replacement for the PT 17171 methadone clinics. So any of those specialties that you would qualify for, you would enroll with those, and then there's a place on the application where you indicate your subspecialties, which is your approved ASAM levels of care through SAPTA. And then once you do that, then you have your individuals who will then enroll. If they're an alcohol and drug counselor, they would enroll using these specialties here on the left, and you will link them to your new group PT93. We already talked about the drop dead date for 3/31/25, so make sure you keep note of that date. There was also a web announcement about this, and I do have web announcements for you a little bit later on. Okay, so the first thing that is important here is the order of enrollment. So to determine which order of enrollment you're going to go in, do you do your group, do you do your individuals, which one's the appropriate way? So what we tell you is that the order of enrollment is if you have a clinical supervisor for your agency. It's not the board supervisor, it's the clinical supervisor who has oversight over your agency. That person should be enrolled first. They may or may not be an alcohol and drug counselor. They could be a provider type 14 behavioral health provider. Those providers can also be linked to PT93. So you want to make sure that that person is enrolled first. Once you determine that they're enrolled, you would then start your group application, and you'll link your individual to the group at that point. We will be going through a high-level overview of the actual live application so you can see how that kind of works. And then once your group is fully enrolled, that's when you start to enroll your additional individuals, your additional clinical staff, and you'll link them all to the group at that point during their initial enrollment process. So it's clinical supervisor, then group, and then individuals and interns. Here's your provider types and specialties that can link to a PT93 group. The ones that are in bold can also be clinical supervisors. I do want to make note that at the very, very bottom there, the 14,300 and the 82,300 is fairly new. That was just effective in October. There was a web announcement about that, but when this first launched, these two provider types and specialties were not able to link to 93 group, but they now can. So if you have any MFT interns, CPC interns, LMSW interns that you need to link to your PT93 group, they are now eligible to do so under their individual prospective provider types. So whichever they qualify for, that these are the ones that can link to your PT93 group. And this is all listed in MSM 4100, which is policy for our PT93 providers. And we will be covering that briefly as well. Okay, so next I'm going to go ahead and navigate out to the online provider enrollment portal and the EBS provider portal. And before I do that, let me take you out to the Medicaid website first. So before we do the actual application, I want to show you where to go for checklists, how to determine if your individuals are enrolled, so you know which order of enrollment to do. So from the main Medicaid website, the first thing I'm going to check is if my clinical supervisor is enrolled. So to do that, you're going to scroll down to under the featured link section on the left, and you're going to choose search providers. This is the database where all of the enrolled Medicaid providers live. And so you're going to choose your provider category. And for this one, I'm going to search for an outpatient behavioral health provider. So it'll be mental health outpatient services because mine's going to be an LCSW. This is just an example. So I have an LCSW who I believe is enrolled as a provider type 14, and they are my clinical supervisor. So I need to see if they are actively enrolled. You leave your specialty blank. I don't know if you can see this. I'll make it a little bit bigger. Hopefully that's a little better. Okay, so you leave your specialty field blank, and then your name, you're going to start with your last name, comma, first name, or you can just do a partial search. So for this particular case, I'm just going to use Miller as my example. And then I'm going to change my results to 100. It'll pull anybody with the name of Miller in their name that's actively enrolled with Medicaid. So there's quite a few results here. And I can see that Sean Miller is an LMFT. We'll say he's our clinical supervisor because he's enrolled. He's a fully licensed therapist. So he is enrolled. So I would then start with my group application first because he's already enrolled. All I have to do is link him. If I didn't see Miller out here on the list, then I would know I would need to start with the individual application first. And we'll go through both of those application processes quickly, just so you can understand that a little better. Going back to the Medicaid website, I'm going to scroll back up to the top. Under the word providers at the top left, I'm going to choose provider enrollment. That's where all of our forms live for the provider enrollment process. First thing you're going to do is you're going to check that enrollment checklist for the PT93s because you want to know what documents you need, both for your individuals and your groups. So we'll click that enrollment checklist here. Scroll all the way down to the bottom, find 93. This I've seen a ton of returns recently about the checklist not being valid versions. We did update the enrollment checklist for PT93 on 11/19, as you can see here. So if you submitted a application for either an individual or a group prior to this day and you're getting a return saying you needed the updated checklist, this is why, because the version that was submitted with the application is no longer valid. So you will have to come out here and download a current version. All right, so I'm going to say my Sean Miller is the one that we were using. He is an LMFT, so he is already enrolled. This doesn't apply to him. But if I didn't have an enrolled person who I'm trying to link, let's say it's an LCADC, and I'm having to enroll this person for the first time, you're going to click on that enrollment checklist, have that person fill this out, sign it, and then you'll upload the checklist with your application. So this also tells you what documents are required as part of the application. For the individuals, it's really their professional license and their signed checklist is what you need to do their individual enrollment. For your groups, that's your 704, 707, and 708, you are going to have quite a bit more documents that are going to be required, additional signatures, one being from that clinical supervisor, another being from the owner or director. or managing employee. There's several other attachments that are going to be required, including the Associated Providers Checklist, an EFT Authorization Form, your Secretary of State, CLIA if you have it. If you are a grant-funded provider, we need copies of that contract. So there's quite a few things that you're going to need to pay attention to. So please make sure you're checking that enrollment checklist before you do any of your 93 applications. Okay, I'm going to go back here. Once you have that enrollment checklist together and you have all your documents together, then the other thing you're going to want to check for is if you need to have your providers that are going to link, starting with your clinical supervisor, have them sign an associated provider signature form. You didn't used to need this as a 17215, but you do need it now as a PT93. And so this signature form, you're going to put the group information at the top, the group NPI, the individual that's linking, their name, their email address, phone number, their NPI printed off. They must sign it in pen to paper, original signature, and then you can upload a copy of this with your group application as well. So it's important to have one of these signature pages for each provider that you'll be linking. Okay. And then the other document that you'll need for the group as well is your EFT form. Even if you already are set up under EFT under your 17215, you do need to set this up under your 93 as well, which means you'll need to complete that EFT authorization form, attach a copy of a voided check or bank letter. You will also then have to go through the pre-note process. So all the PT93 new groups, they'll set up their EFT, and then once your enrollment is approved, you'll go through that pre-note process, which will be paper checks, while the financial institution information is verified, usually about 3 to 4 weeks. And then once that's verified, you'll go to an EFT payment every Friday. So until then, it will be paper checks, just so you're aware of that. And you can tape a copy of your voided check at the bottom of this, or you can attach it as a separate document, but this also has to be included with your application for the group. So those are the important things that you need to note here under the required enrollment documents. There's some other documents, of course, that'll need signatures, provider contract, checklist, like I mentioned, and then anything else that's listed on that enrollment checklist you'll have to have prepared and ready to go. Let's just say I'm ready to go as an individual, that I'm going to start my enrollment process. So I'm going to go ahead and go up to the online provider enrollment portal and start that application for my individual clinical supervisor. You can either click the here in this top blue box, or you can go under featured links on the left and click on the online provider enrollment link here. So that'll take you out to the online provider enrollment page. To start the application, you're going to click here. I do have one that's already filled out and ready to go, so we're going to save time, and I'm just going to resume that enrollment. Get logged in real quick here. Okay. All right, so you're going to go ahead and continue and get to that first page, the request information page. This is our individual. We're enrolling as a PT93 and our requested effective date. We are going to cover those web announcement updates. We'll talk about that in a few minutes, but your requested enrollment effective date should be, let it default to whatever day is currently. So put that there. You do have to answer the question as to whether or not you're going to be submitting secondary claims to Medicaid. I'm going to say yes, because I never know if I'm going to have a person who shows up who has primary insurance. And then you're going to choose your primary specialty here. I'm going to remove what's out there just so we can go through this process. The specialties that we just looked at for the enrollment checklist will also appear here. So pick the appropriate one for the person that's enrolling. We said this was going to be an LCADC. You do not have to enter the specialty board here. So once you just click that specialty, it'll populate the specialty code here. That's the checklist that you'll need. Make sure you click add. And then under the group association, this is really the tricky part here. So when you do your first application for your clinical supervisor, you are not linking to the group because the group is not enrolled. So you're going to say no. It automatically defaults to no, let it stay that way. And then you're going to go down, put in the social security number, um, answer the questions accordingly. Here under the billing type, you'll see that this is a performer only. You cannot change this to a biller. PT93 individuals are billers, are performers only, and cannot get paid directly from Medicaid. They have to be linked to a group, so you don't get to change that there. Answer these two questions here, whether or not you're enrolled or ever been enrolled. Enter in your contact information and then continue. And then you'll enter in your addresses as appropriate. So this is not a change, this is all the same. On the provider identification page, you'll enter in the information as you would have before for your individuals. And then here under the licensing section is where you're going to enter their board information. So their alcohol and drug board license details. So you'll enter in their licensing board is not available. It doesn't show the alcohol and drug, but it has been expanded. So it's quite a bit longer, but there's not an alcohol and drug one. So just use the option for other for your individuals. And then their license number as issued by the board. This person should be attaching their professional license as an LCADC from Nevada. And then their effective date will be the original issue date. And then the end date will be the current expiration date. And then you'll do add or save. So now to roll that up very nicely. So for individuals, you only need just that one license line because that's what qualifies them to be enrolled as an alcohol and drug counselor under Medicaid. Going down to the business information, you put in individual provider here. That's from the Secretary of State. It's not required as an individual. So once you enter individual here, you don't have to enter any of this information down here. So just make sure you're choosing individual for the PT93s. CLIA doesn't apply for, the CLIA doesn't apply for individuals. It's only for groups. So you wouldn't be populating this. It's not required. You do have to answer the DEA question as to whether or not you have a DEA license. And then here under taxonomy, that's still it's still the same. So you can put in the appropriate individual's taxonomy code. And then what's new on this page is right below that is the intern panel. So your supervisors, if they have interns that they supervise, they are expected to put in their intern information of those individuals that they supervise. But for the initial application, you cannot put that in there because nobody else is enrolled. Unless if you have an enrolled MFT intern or CPC intern, you could put that information in there at that point. But this is just assuming that the clinical supervisor is the first one to start that application. So since there's no enrolled interns, you're just going to leave these fields blank and then you'll do continue. So this is the biggest change on the individual's application. All of the rest of the pages are basically the same. You let the EFT default to yes. If you enter no, then you're required to enter EFT information for that individual, but they are not being paid directly from Medicaid, so you don't need to enter that information. So just let it stay yes. And then I'm just going to go ahead and go through to the attachments page just so you can see the amount of attachments that are going to be required. So I'll just put information in here really quick. And be sure that you're putting in hours and days. And then whether or not you're going to be servicing fee-for-service, managed care, or both. And answer these questions accordingly. And then we'll go to the ownership page. Individuals do not have to have ownership because they own their own NPI, so you don't have to fill out the ownership section at the top, but you do have to answer the questions at the bottom under the disclosures. So anything that has a red asterisk here, you need to make sure that you're answering those questions honestly, and if you say yes to anything, you're also going to be either required to attach an attestation or explanation letter or court documentation from regarding the case. Normally I can do this fast and it goes quickly, but not today. All right, so moving on. And I'm going to go ahead and just download my contract so I can get that checkbox. You do need to fill out this 5-page contract for all new applications, so new individuals, new group. It's a 5-page document. You're going to go scroll down to page 5, fill out page 5. You can type it all in except for the signature. Then you're going to print off the entire 5 pages and have it signed by the individual enrolling or the group that's enrolling, and then you're going to attach the signed contract to the application as well. So once you download that, you can fill it out, print it, sign it, and then upload it. But to get this checkbox down here, I did have to download this contract. And then you can check the box. You're going to put in the individual who's enrolling, their name, and this person was Jane Doe, I believe. And she is the provider. And then here on the attachment section. So our attachment types, there's quite a big list here. They're not all applicable unless if you have court case documentation that you need to attach, then you're going to pick the appropriate one that describes the question that you answered yes to. But you're going to need your checklist. You're going to need, the other would be your provider contract. You're going to need the professional license for the individual. And that would be it. So unless if the other things apply here, then you're just going to choose the one that's appropriate. So I'll say checklist. You're going to choose that file and go out and find your file. And I'm just going to say it is my provider contract, even though it was supposed to be the checklist. And then once you see the description here, oops, then you can do add. Hey, I must have removed it. Okay, let me try that again. Okay, now you can see the attachment description here, and then you do add, and you can do this as many times for the documents that you have to add, so you can have multiple line items here. Then I'll just continue to my summary page, and then that's where you're going to review your information and submit it. So that's your individual clinical supervisor provider type application. That will go through the review process. Once they are approved, you'll get that notification via email and by hard copy letter, and then you're going to go ahead and start your group. So let me cancel this one. So before I exit out of the individual process, does anybody have any questions about what an area specifically on the application before I log out of it? If you do, you can go ahead and either put it in the chat or raise your hand.
There are no questions in the chat.
Awesome. Thank you so much. All right, so now my enrollment is approved for my individual. I'm going to create that group application, which again, I have that one already started, so I'll resume my enrollment there. Of course, I didn't put that in. So sorry about that, you guys. My fingers are not working correctly today. I think I just am typing in the wrong password here. Here we go. All right, we'll continue on to that first page, request information. Here is where I'm going to designate my requested enrollment effective date. Actually, that's a lie. It's not like that anymore. So you're just going to let it default to today, because what's going to happen is just as of last week, we posted a web announcement about not being able to backdate PT93 applications on their enrollment effective date. So it's going to default to the day that we actually approve the application. Where this is going to be important is on your subsequent enrollments for the additional individuals. So this enrollment effective date, we're going to let it default to whatever the current day is, because enrollment is going to change that date to the date they approve the application, regardless of what you put in here. And that is going to stay in effect until 3/31/2025. There's a reason for that, which I'll cover when we go over the web announcements, but it's important that you are aware of where the enrollment effective date lives and how to find out what that's going to be once your application's approved. So we'll cover that too as well. So I'm enrolling as a group under PT 93. I'm going to enter in my specialties down here. So let me remove what I have so you can watch this process. And my first thing I'm going to enroll as is my primary specialty. So my group specialty is either my 704 for the substance use treatment in an IMD or your residential services, or substance use treatment in a regular clinic, which was your old 17215s, or your opiate treatment specialty 708. So I'm just going to choose 707 because that seems to be the most common one so far. It'll populate that specialty code so you know you need your enrollment checklist for 707. You'll add it. And then once you add that, you need to go back in and add a subspecialty. And so when you're adding your subspecialties, these are your ASAM levels of care that you're SUT certified for. So you should see an ASAM level 2.1, 2.5, 3, or outpatient behavioral health services, which is equivalent to your ASAM level 1 or outpatient services. So I'm going to start with my level 1. I'm going to add it. I'm also SAPTA certified to do level 2.1. And I'm also SAPTA certified to do level 2.5. You can add all of them here if that's appropriate. Just know that on your enrollment checklist for the 707 group, you need to make sure that you're indicating the same ASAM levels of care on your checklist, pages 2, I think page 2, or bottom of page 1, top of page 2. You need to make sure you're checkboxing the same ones that you're adding here, so it should match. And your federal tax ID number for your agency, you can use the same NPI, same tax ID, same Secretary of State, same EFT that you currently have on file under your 17215. You can certainly do that. What's really important if you're going to do it that way is that you answer these two questions here correctly. So your before we get here, your billing type should be both. We say that for group providers because that allows you to submit those PAs, bill for claims, and allows that agency to act as like the mothership of your agency in the structure. So you need to make sure you choose both here. And then if you're using the same NPI, you're going to say, yes, you're enrolled as a provider. Yes, you were previously enrolled as a provider, and you're going to indicate that NPI. So if it's your 17215 NPI, you put that in here. If you're using a different NPI for your 93, you just answer no to those. And then your contact information here, your addresses, those are all the same. And then you're going to enter in your legal name. If you have a DBA, you're going to answer the question as to whether or not you are privately owned or state owned. And then if you answer yes, you need to indicate the special ownership type. Same NPI again if it is the same. In your license section here, this is a little bit different than how it used to be. We did do some updates and maintenance on this section here. So here's where we want you to enter in your SAPTA certifications. If you are a DPBH funded provider, your DPBH license, and then that would be any other license that you have as an agency. So you're going to list all of those here. So I'm going to list each one of my SAPTA certifications if I have multiple certs. If it's just 2 for your co-occurring and for your ASAM levels, you can just enter in 2 of them, but just make sure that you're choosing the appropriate certification number. The licensing state should be Nevada. Your original effective date or original issue date should be here. And then that current end date or expiration date of the license, as it should be like 2025 or 2026 would be my guess. I just put in an unlimited date here so I don't have to go in and do this all the time. So yours should not look like that. You do want to make sure that you are entering in all of those individual licenses or certifications so that that's listed out there. Here's your Secretary of State section. You're going to indicate what type of entity you're registered as under the Secretary of State. Would say on your business license itself, or you can go into the Silver Flume and also see it there. So you're going to list that here, and then you're going to put in your NVID number, the Secretary of State registered name as it lives on that Silver Flume website, your original formation date, and the next renewal date. If you have a CLIA for your group and you're going to be performing out of your 93 agency, you need to have that CLIA number on certification here in these fields here. If you have a DEA, you would enter yes. Otherwise, it defaults to no. I'm sorry, you have to answer no. And then your taxonomy code for your group. So pretty much all the same information here except for the license section. This is a new page here where you probably have never seen this before unless you've enrolled as a 93 or going through that process. You do have to enter in your associated providers, the individuals that are linking to the group. So this is where it's important to have your individuals enrolled because you cannot link an unenrolled provider. So that's why we start with the clinical supervisor. You're going to link them here. So my enrolled person was Marsha Brady. She is enrolled as my PT93 clinical supervisor. I'm linking her with her individual NPI here and her name, and then you're just going to add them here. So she will link, once the group is enrolled, she'll link to them with that same effective date. And then you're going to continue here. If you have multiple enrolled providers, you want to link them all now, you certainly can do that. You just cannot link unenrolled providers. So this is the part where you're going to, like if you have interns for CADCs or LADCs, or just your regular peer support, peer recovery support, you'll do all of those later on. So this is the step 2 where you link these two providers together. All right, and then your EFT, you're going to enter in the EFT information for the group. And you're going to answer the questions accordingly here. And your ownership and disclosure will all be the same as they have been before. There's been no changes here. So you just make sure that you identify one owner and one managing employee, or if it's a corporation, you'd have board members if there's no ownership. So just make sure your structure is appropriate according to how it currently is, either as a 17215, or if there's been changes, you can just make the changes at this point because it's a new application. So if you have new board members you need to add, you're not required to do a change of ownership due to the new provider type being implemented. It's just considered a brand new, so it'll override everything before. All right, and then you're going to answer all your disclosure questions as normal. And your terms of agreement page, this is where you're going to identify if you want 1099s to be electronic for the next coming year. If so, you need to download a copy of the consent as well as the provider contract. This will need to be signed as a group provider, so you'll fill it out as the group. Have a managing employee or owner or director sign in the signature lines. That allows you to get this checkbox here. It has to be an authorized user that you're putting here. And then continue. You will attach that 5-page contract to the application in the attachment section here, as well as anything else that's listed on your checklist, including your checklist. So you're going to have to add EFT, associated providers, checklist, CLIA if you have it, Secretary of State, anything that's listed on your checklist that you have checked off that you have, you're going to need to make sure it's attached here. And you should also see your specialties listed up here so you can verify you have the right ones. Added in that first step, it'll kind of line it out here so you'll see it. And then once you're done, you just go to your summary and then click confirm if everything looks appropriate. That is your group application. Any questions on the group process before I log out of it?
There are no questions in the chat.
Perfect. So next, once my group has been approved, I will have a clinical supervisor link to that group, but any of my other individuals that I need to either link or enroll in link, I'm going to be doing now at this point. So we're going to go in and create a intern alcohol and drug counselor application. So I have one again started, so I'm going to resume that enrollment. All right. So this person here is going to be my CADC intern. What's really important now at this point, now that your group is enrolled, is this requested enrollment effective date. For anybody that is currently working for your agency that you need to bill claims for, this date here needs to match what the group enrollment effective date is. So if your group got approved on 12/31, that's the date you need to use here to enroll these individuals and link them. That way you don't have any gap in dates of service for claims where you're having to go back in and change effective dates. You just want to make sure that you do it from the start and make sure that date is correct. So we'll just go ahead and use 12/31 just as an example. Whoops, these fields are horrible. Okay. And then your specialty, you'll add your appropriate specialty for your individual. Make sure that that's the same check or the checklist that you have filled out and signed by the individual. And here, now that my group's enrolled, I'm going to say, yes, I want to link to that group. You're going to add that group NPI information here. Oops, expand that. You're going to indicate the affiliation begin date, which would be the same as the enrollment effective date. And then save. So I am linking to my group that was enrolled on 12/31. My linkage date is also 12/31. So now I am going to be good to go to bill claims back to 12/31 under my PT93. Enter in their social security number. Again, their billing type is not an accessible field. They are all considered performers. And then answering the appropriate question here and your contact information. And moving through the addresses, those are no changes there. So on the provider identification page or page 3, here's where you're going to put in the professional license information here. Of course, you'll fill in all the other boxes above. Put in the professional license here, the original issue date, the current expiration date. Indicate they are an individual provider. Put in their taxonomy code. And then down here, this is a new panel, so supervisor information. This is where you need to indicate who the supervisor of the agency is for this individual that is enrolling under the PT93. So I have an enrolled clinical supervisor by the name of Marsha Brady. Marsha is going to enter in, or you're going to enter in Marsha's NPI. This field here will default. And the only fields you need to fill in here is anything that's marked with a red asterisk. So you fill in your NPI, your contact phone number for the individual, and the effective date. So for her, I'm just going to say it's 12/31/2024. And then you'll hit add or save. Again, this provider that you're entering in the supervisor panel must be the enrolled clinical supervisor for the agency. It's not the board approved supervisor, it's the the agency supervisor who has clinical oversight of that location. So this is new. So anytime you have an individual who's enrolling under your PT93, you do need to indicate that clinical supervisor for the agency here in this panel. So that's new. And I'm going to continue through the EFT. Here it's going to default to yes. Yes, the group's going to pay me. Put in your information here like we did before. And then answer whether or not your fee-for-service, managed care, or both. Answer these questions accordingly and then continue. Your ownership is going to be the same. You don't need individual ownership listed, so you can bypass the ownership section at the top and just go down to your background and disclosure questions and answers. Again, same thing. Make sure you read those questions very carefully, answer them honestly. If you mark yes on anything, you need that cover letter, explanation letter, or the court documentation. Okay, I think I'm done here. All right, so continue through to the terms agreement. Again, same process for terms of agreement. You need to download that contract, fill out the 5-page document, and attach it as part of your attachments. But this checkbox, we do have to do that process. It was Gregory Brady. You can see the Brady Bunch is my go-to person for my go-to people for these applications. All right, and then, oops, he's not the representative, he is the provider. Let me fix that. Okay. And then we're on the attachments, so you're going to attach this person's intern professional license, their enrollment checklist, and their provider contract, the 5-page contract. So you can see again, the attachment types have been expanded, so it's quite detailed now. Again, you don't have to pick all of them, just those that apply. And I'll go ahead and pick my provider contract again, and then add, and then continue, and then your summary page, and you'll scroll down and click confirm once everything is reviewed and approved. So once your individual has been approved and linked, that is when you can start billing claims for the individual providers who are enrolling as individual PT93s or those individuals that are already enrolled as 14s. Your claims have to have that rendering NPI. It is no longer the group NPI. It is that individual that's providing the service for your PT93. So any claims for the dates moving forward after your enrollment is approved, those are the claims that you're going to bill under your PT 93 provider type. Anything prior to that date will still go through your 17215 provider type. And what that looks like in the portal, I will show you here in just a moment. Before I go there, is there any questions on the actual individuals or interns that are enrolling after the group application has been approved? Yes, Chris, your question is to add an LCSW as an example, do we do the associated provider list and add using the update provider? Yes, you would do that through your group provider portal. Once your group is approved as a PT 93, you can actually add that individual at that time. So if you're trying to add an enrolled LCSW, you're going to add that just like we did for our clinical supervisor. You're just going to put that person's NPI on your group application in the associated provider section, have an associated provider signature form for that individual. And once that group is enrolled, that person will be linked to the group at that time. If it's after the group's already enrolled, then yes, you would do it as an update through the group portal and have that associated provider signature form as your attachment. All right. So I'm going to head over to the provider portal just so I can show you what to expect to see once you're enrolled at a PT 93 if you're using your same NPI. Oh, my password is different. I forgot about that. I had to change it just recently, so apologize. Okay, so once you are enrolled as a PT 93 using the same NPI, what you'll see here on this home page is you're going to see your PT 93 information, because once you're enrolled as a 93, your 17215 or 171 contract terms the day before you are approved as an enrolled provider for 93. So if you're approved on 12/31, your 17215 contract will term on 12/30. And in most cases, it's a retro term date. So if you have claims that you've billed under your 17215 while you were waiting for your 93 to be enrolled, you may have to void those claims under your 17215 contract and resubmit them as a PT 93 if it's the dates of service fall on or after your enrollment effective date. How do I find my enrollment effective date if I'm not sure? You will get an email when your contract has been approved. That email will then direct you to your portal. You can log into the resources tab at the top, and then you're going to select report download. You can pull all provider enrollment letters by choosing the right category for provider enrollment. And you just want to make sure that you're choosing the date that is within the date range that you got notified of that, of your contract being available for you. So if you got notified on 12/31, you would put 12/31 as your date range here. I'm just going to say, I think mine's been enrolled for quite some time, but I'll just see if I can pull anything here. Any enrollment letter that you have received will then display in this list. And mine didn't because I got an error. But if you have, if you were enrolled, you'll see your welcome letter, you'll see your provider contract, they'll all display here for you. You'll look at those for your enrollment effective date for your group, and then that's the date you'll use for all of your individuals, again, moving forward. So that's how you can find that out if you aren't waiting for mail and you're not sure how to get access to those letters. If you didn't get one or you need to reprint it, or for your individuals, you can pull those reports from report download. Going back to my home page, your location ID, this is important to note here. This location ID being displayed, that is associated with your PT 93. And I know that because when I go to submit a claim, I'm going to do a professional claim or care management, either one. You'll have to choose which contract you're submitting it under. So when I choose my billing provider, I'll see my old 17215 and I'll see my new 93. Your location ID is associated with your 93 because that's the active contract. That is what displays, but you can go and bill under your 17215 if you need to still up and through the end date when that contract was terminated. So if I have claims to bill through 12/29, I would choose this line item and I would make my rendering provider my 17215 group provider because that's the rules for the 17s. If I'm billing from 12/31, because that was my approval date, I'm going to choose my 93 and I'm going to add my individual rendering NPI because that's the rules under 93. Okay, so let me cover some of the updates, which I've kind of talked about throughout the training, and then we'll open it up for questions because I know we are running short on time. I'm going to log out of here and show you some of the web announcements that are going to be super important here. So I'll go to view all web announcements. Let me get those for you here. Just one moment. Okay, so I actually have a PDF document where I've listed all of the web announcements through the most recent one that I would be happy to email out to everybody so that you have a list of those that are applicable to the PT93. But the one that's super important that we talked about, the enrollment effective date, is this web announcement 3497. I'm sorry, yes, 3497. That is for the deadline for 3/31/25 to enroll as a PT93 in order to be reimbursed for services under the ASAM levels of care. And then the newest one about the enrollment effective date being changed to the date of approval as opposed to the actual enrollment effective date that was on the application. That is in effect until the end of March. So if you are interested in this list of web announcements, I will email it out to everybody who's in the attendance today. So those are some of our important things here. And then I'm going to go ahead and stop talking now and open it up to questions, and I can navigate to any particular site resource that would be appropriate to help answer your questions so you have somewhere to go to. The one thing I did forget, though, I apologize, is going to the YouTube videos. So if you want to go into a more depth enrollment workshop, you can hover over providers again here and select provider training. And then you're going to scroll down on the provider training page to our self-paced training. Here's where our YouTube link is. That'll take you out to our YouTube channel. And then what you'll do when you get here is you go to playlists. And then you can see, oops, it's not there. So go to videos. And it's kind of small. So if you go to videos, and over here is the substance use treatment provider workshop. This was recorded back in July, I believe. So it's still relevant, but there have been some updates which I've shared with you today. So I want to go ahead and open it up for questions now. I do see that there is at least one in the chat. So Alyssa, do you want to facilitate those and we can kind of go through the answers?
Sure thing. There's one question in the chat, and they're asking, is there a way to get individual help with the process, like having someone come to the facility to train the clinical team and the ED? Or can we obtain a copy of the recording? We have had our clinical director submit 3 times, and there's always something that is stopping us. We're running out of time. Just to be honest, getting someone on the phone is impossible. So Teresa, on site would really depend on where you are physically located. However, any type of one-on-one can be facilitated through Susan or myself. Do you know what provider type the clinical director is attempting to enroll as?
I'm also putting my email address in the chat for those of you who have not worked with me one-on-one before. You can email me your NPI and any ATN reference numbers that you have related to the PT93 enrollment, and I'd be happy to work with you, get something scheduled. We can do one-on-one training sessions. We can do virtual training. So just like we're doing today, we can do one-on-one to help you get through that process as well. So that's my email address. Teresa, if you want to go ahead and just reach out to me with those NPIs and ATNs, we can get something set up for to get you enrolled, okay? All right.
One question coming into the chat from Deanna Tucker. I'm unsure how to log in for a new LCSW to our agency to update the current enrollment with the Nevada Medicaid at a previous agency, especially if this individual never managed an EVS provider login or never had registered. Okay, Deanna, if you want to go ahead and the quickest way to verify if someone's ever been enrolled before is to go to the portal and select register now under that login. You would follow the prompts as if you're registering a brand new, oops, Susan's doing that right now, as if you're registering for the first time. If that person has already registered, you will get an error at the end stating, hey, this NPI is already registered. In that situation would be your indicator to contact the call center or EDI support to get logged in. If not, and you are able to get through, that means you have just registered that person. So it's kind of the best way to determine if because that does happen quite frequently, to determine if anyone at their previous place of work has ever registered them before, because the system will automatically tell you yes or no. Otherwise, you would want to another avenue, if you didn't want to do it this way, would be to try to contact them or have the person, the LCSW, do this themselves, or try to reach out to someone who they may think has done registration or portal
And
enrollment before.
yeah, and if you're not able to, let's just say you get that the error that's or the message that comes back that says the provider's already enrolled, you don't need to re-enroll or re-register. You can email our EDI inbox, EDI support inbox, and they will, but it has to be the authorized user or the individual provider. So if Marsha Brady is your provider and you're emailing on her behalf, if you're not listed as an authorized user on her profile, then you will not be able to get that information. It's important to have those individuals email directly. We can put that email address in the chat for you. You're going to email them and just let them know that you're unable to log into your EVS account. You're going to give them your first, last name, your NPI, and your contact information. They will then take it from there and give you instructions on how to get logged in and get that information reset so you can access it. So truly, those individual providers should own their EVS accounts. If they want to give you delegate access to manage on their behalf, they can certainly add you as a delegate once they get access to their individual account. If you're not sure about that process, that is covered in EVS Chapter 1. So I'm going to cancel out of this because I was able to get past the enrollment here. So go to EVS Chapter 1, and you would get that through hovering over EVS on the main provider website, and then go to User Manual and read through Chapter 1. It's important to get that going anyways. The reason is because we have MFA or multi-factor authentication rolling out on just January 25th, I think, later this month. And it's going to
22nd.
And it's really important to make sure that you are able to get into your accounts. And if not, because you can't be logging in as somebody else or owning their EVS account. It belongs to the registered provider. So it's important to know that and get that process going for you correctly. If you want to access their NPI and they authorize that, they can add you as a delegate, create a delegate account for you, and you can access their account with whatever rights they assign to you. So it's important to get that understood and going and in place prior to that January 22nd. Thank you, Alyssa, for posting that in the chat. You put that web announcement about the multi-factor. Yeah, perfect. Awesome. Hey, we are getting close on, it's actually 1:30 now. So if you are good, you are welcome to leave. I will hang out here for a couple more minutes and answer any additional questions. If you want to stay on, come off mute or put your questions in the chat, you certainly can do so. If you're comfortable with leaving and comfortable with the enrollment process itself, or if you need to reach out to me directly, please don't hesitate to send me an email. We do appreciate you being here.